I've been a doctor for more than 30 years, and what I'm about to share still makes my stomach tighten when I think about it. One morning, after fasting all night, I walked into the lab for my own routine blood test. I'd told thousands of patients how to prepare, so of course I assumed I was doing everything right. When the results arrived, they painted a terrifying picture: high cholesterol, kidney problems, and blood sugar that looked pre-diabetic. I remember staring at the paper, whispering, "This can't be right." A week later, I repeated the test, this time following every hidden rule I'd learned the hard way. The results came back normal, completely normal. That's when I realized something disturbing. Millions of seniors are walking around with false results simply because of what they do or don't do before the test. And the truth no one likes to admit? The system profits from your confusion. The more abnormal results you get, the more follow-ups, prescriptions, and lab visits you'll pay for. That's why today I'm exposing the 10 most common mistakes senior women make before a blood test, counting down from number 10 to the single most dangerous one at the end. But before we dive in, a quick disclaimer. This video is for educational purposes only and is not medical advice. Now, before we start our countdown, tell me in the comments, how old are you and where are you watching from? I love seeing this global community of wise, vibrant women learning together. All right, let's begin. 10. Not drinking enough water. Most women think fasting means nothing at all, so they skip water too. But dehydration thickens the blood, concentrating waste products like creatinine and urea. Suddenly, your kidneys look like they're failing when they're perfectly fine. A 2017 study in the American Journal of Kidney Diseases found that even mild dehydration raised creatinine by 14% in older adults, enough to shift a healthy reading into the disease range. Take Ruth, 71, a retired teacher. She fasted 12 hours without water and was nearly placed on a kidney protection diet. The retest, after 2 glasses of water that morning, was spotless. The fix is simple. Water is never your enemy. Unless your doctor tells you otherwise, drink 2 to 3 glasses before heading to the lab. Your veins will thank you, and your numbers will tell the truth. The next mistake, it's about what you drink instead of water, something millions of us can't start the day without. 9. Morning coffee or tea. I know, I love my morning coffee too. But even black coffee isn't neutral chemistry. Within minutes, caffeine raises cortisol, blood pressure, and blood sugar. In a 2013 research at the American Journal of Clinical Nutrition, coffee before a glucose test spiked blood sugar by up to 8% in older adults. That's enough to shift you from normal to pre-diabetic. Linda, 69, a retired nurse, drank her usual cup before her test and nearly left the office with a new diabetes diagnosis. 1 week later, no coffee, perfect numbers. So for a true baseline, skip caffeine until after the needle. 1 morning without it buys you months of accurate care. The next mistake is sneakier because it comes disguised as health itself. 8. Taking vitamins or supplements too close to the test. We pop them faithfully thinking they're harmless, but some supplements distort results more than junk food ever could. Biotin, vitamin B7, used for hair and nails, can fake thyroid disease. Iron pills can create falsely high iron stores. Even vitamin C interferes with glucose testing. Patricia, 67, a retired accountant, took her multivitamin the morning of her test and was told her thyroid looked unstable. After a retest, without the pill, her results were flawless. A 2018 review in Clinical Chemistry and Laboratory Medicine confirmed that biotin alone can make hormone and cardiac tests unreadable. So wait until after the blood draw to take supplements. 1 skipped morning won't erase their benefits, but it can prevent weeks of unnecessary panic. But still, that's nothing compared to the damage done when someone skips something far more serious: their medication. 7. Stopping regular medication without asking the doctor. This one terrifies me because I've seen it cause real harm. Many seniors stop their pills before testing, hoping for a pure result. In reality, that decision muddies everything. Eleanor, 72, a retired store clerk, skipped her thyroid pill before testing. Her levels looked dangerously low, and her doctor nearly doubled the dose. When she confessed, they had to redo everything. If your test is meant to monitor how medication works, blood pressure, thyroid, or diabetes drugs, your results must reflect life with that medication, not without it. Unless your doctor specifically instructs you to stop, never change your dosing routine before a test. Health isn't a guessing game, it's a partnership. And while skipping medication might sound risky, the next mistake seems innocent, a single bite of food, but it can rewrite your entire report. 6. Breaking the fast even a little. I only had half a banana. Those 6 words haunt lab technicians. Anything with calories, yes, even a cracker, triggers insulin and digestion. In a 2018 Journal of Clinical Laboratory Analysis study, a small snack within 8 hours of a fasting test changed glucose and triglyceride readings by up to 30%. For seniors, slower metabolism makes it worse. Helen, 70, a retired office worker, nibbled on toast before testing and spent 2 months thinking she had high cholesterol. The retest after toast was 20 points lower. The rule couldn't be clearer. Fasting means water only. No gum, no juice, no sugar in your tea. That tiny cheat can cost you accuracy for every number on the sheet. But if food can alter your results, the next mistake attacks from the opposite direction, what you drank last night.
Number 5, drinking alcohol the night before. Just 1 glass of wine. I hear it every week. Even moderate alcohol changes liver enzymes, triglycerides, and blood sugar for up to 24 hours. A 2019 review in Clinical Biochemistry showed liver enzymes rising 15 to 20% after a single evening drink. Joan, 74, retired librarian, enjoyed a glass of Merlot before testing. The next morning, her liver numbers screamed trouble. 1 sober week later, everything normalized. Alcohol dehydrates too, making kidneys appear weaker than they are. The fix is simple. Skip alcohol for at least a full day before your test. You'll walk in hydrated, clear, and confident. If alcohol can distort your results, what about something we're supposed to do for our health? Exercise. Number 4, heavy exercise before the test. Activity is wonderful, but timing matters. Strenuous workouts flood the blood with enzymes like CK and AST, mimicking muscle or liver damage. Susan, 66, a retired teacher, did a hard spin bike session right before her test. Her liver enzymes were double normal. Her doctor nearly ordered an ultrasound until she admitted the workout. A 2020 study in Sports Medicine Open found that high-intensity exercise can elevate CK for up to 48 hours, especially in older adults whose muscles recover slowly. So keep movement gentle the day before and the morning of your test. A short walk is fine. A marathon of squats? Not today. And if overexertion can fake disease, the next mistake can do the same through something you can't see or touch, your stress hormones. Number 3, poor sleep and high stress. You wouldn't think a restless night could alter a blood panel, but it can. When you sleep poorly, cortisol surges, raising glucose, blood pressure, and even cholesterol. A 2015 Journal of Clinical Endocrinology and Metabolism study showed fasting blood sugar jumping 20% after just 1 sleepless night. Helen, 70, couldn't stop worrying about her results and slept barely 3 hours. Her blood sugar looked pre-diabetic. After 1 restful night, it dropped back to normal. The fix? Treat the night before your test like self-care. Dim the lights, skip screens, and breathe deeply. Your lab result will look as peaceful as you feel. But even when you rest well, there's one mistake that doesn't happen in your body itself. It happens in the doctor's office itself. Number 2, hiding health habits from your doctor. This one breaks my heart. Up to 60% of patients, according to a 2018 JAMA Network Open survey, admit they hide something from their physician. smoking, alcohol, supplements, out of embarrassment. Margaret, 68, a retired bookkeeper, didn't mention her herbal liver cleanse. Her enzymes spiked and she endured weeks of fear before confessing. The supplement was the real culprit. Honesty is the most underrated medicine. Doctors don't judge, we interpret. And every detail you share helps us protect you. So before your next test, be open. Tell us what you took, ate, or drank. You deserve a diagnosis based on truth, not guesswork. Now we've reached the number one mistake, the one that can sabotage nearly every test on the page: not following the correct fasting hours. This single error causes more false results than all the others combined. Fasting too little means food still affects your blood. Fasting too long means your body releases stored sugar, raising glucose artificially. A 2019 Journal of Clinical Laboratory Analysis study showed that breaking a fast an hour early raised triglycerides 25%, while fasting over 16 hours pushed glucose higher from stress hormones alone. Dorothy, 75, fasted 18 hours instead of 12. Her results suggested diabetes. After retesting with the correct 8-hour fast, everything normalized. For seniors, slower metabolism amplifies both extremes. That's why I always tell my patients, confirm the fasting window with your doctor, usually 8 to 12 hours, and stick to it precisely. Water only, nothing else. So there you have it, the 10 mistakes that quietly rewrite blood test results for millions of senior women every year. Dehydration, caffeine, supplements, skipped meds, midnight snacks, alcohol, overexertion, stress, silence, and the fasting window itself. Each seems small until you see how those numbers ripple into your life. False diagnoses, unnecessary pills, sleepless nights. I've watched it happen, and I've lived it myself. These aren't tiny missteps, they're choices that decide whether your doctor sees the real you on that sheet of paper. Remember, your blood test doesn't just measure health, it measures preparation. So next time you roll up your sleeve, think of Ruth, Linda, Patricia, Eleanor, Helen, Joan, Susan, Margaret, and Dorothy. Women just like you who learned that a few mindful hours can protect years of peace of mind. Have you ever made one of these mistakes before a blood test? Maybe a sip of coffee, maybe fasting too long. Tell me in the comments. I read every single one, and your story could help another woman avoid the same trap. If you found this helpful, give the video a like, share it with a friend who has a test coming up, and subscribe for more science-based senior health tips. Because sometimes the smallest change in your routine can make the biggest difference in your health. I'm Dr. Sarah. Thank you for watching, and I'll see you in the next video.